Unsafe abortions are a global pandemic, with only 36% of women around the world being able to access them upon request. Elsewhere, there are laws restricting access, with abortions completely banned in 6% of countries. Even without legal restrictions, there are still financial and social barriers limiting access to safe abortions.
96,000 women a day resort to an unsafe abortion, translating to 67 women per minute. This is one unsafe abortion for every 7 live births, causing 22,000 deaths annually.
Unsafe abortions are extremely dangerous to the women and can cause serious complications such as psychological distress, infection, permanent damage to the uterus, incomplete abortion and hemorrhaging.
The challenge of unsafe abortion is exacerbated by undertrained doctors and students, which is a consequence of inadequate training opportunities present across the globe, limiting the accessibility to safe abortion.
This has been most recently highlighted in America, where in the past 3 years, access to abortion has dramatically decreased, with restrictions being introduced in many states and more expected to follow. These restrictions mean that some medical schools no longer provide abortion training for obstetrician trainees. As a result, students are resorting to travel to receive training. Also, organisations such as Medical Students for Choice provide a travelling education programme. However, since no simulation model for abortions currently exists, they have to use papayas as models.
32% of medical schools only offered one abortion-related lecture during clinical years. With the overturning of Roe v. Wade, the number of obstetrician residents in the US with access to abortion training is predicted to decrease from 92% to 56%. Our simulator will provide students with training for surgical abortion techniques in a practical and realistic way. The life-size torso will be anatomically correct. Furthermore, the model can be attached to a person for a more realistic clinical simulation. Our model will be able to simulate the different abortion techniques required for each gestational age up to 26 weeks. This could be extremely helpful for all obstetricians, as similar birthing simulators have been shown to improve students' understanding and confidence in these situations.
We will provide training via Zoom, making education accessible from anywhere in the world, and this will be supplemented by pre-recorded videos on our website. We have links on the website to allow for donations directly to our partner charities.
By working with Medical Students for Choice in America, we will provide teaching to medical schools, focusing our efforts on where law restrictions are the greatest. To increase the accessibility of safe abortion globally, we've partnered with the Safe Abortion Access Fund to distribute our kits to their local charities across the world.
We have several health professionals in this area who agree that an abortion simulator is a much needed resource for obstetrician trainees worldwide.